Hi, my name is Marieli Colon, and I am one of the doctors that works in American Foot and Leg. I have been working here for 8 years. Bunions are one of the most common conditions that we see in our office. It is extremely common, and a bunion is a deformity in the big toe. Usually you will see that your big toe goes towards your other toes, cramming the other toes, and you can see a prominent bone in the side of your foot. Usually the primary cause of a bunion is hereditary. It could be caused by ill-fitting shoes, as well as trauma or sometimes medical conditions like arthritis, but it's mostly inherited, like you inherit your eyes and your hair color from your parents. The bunion is the bony prominence. Most of the time it presents with symptoms like swelling, redness, and extreme pain when wearing tight-fitting shoes. And sometimes it is just pain while bending the foot or bending the toe. Anytime that you have any abnormality in your foot or anytime you have pain, you should always go to the physician to make sure that there is no problem with it. There's different ways of treating bunions. There is the conservative way and the surgical way. Usually we first start with conservative, which includes padding of the area, wider shoes, anti-inflammatories such as Advil, ibuprofen, or prescription medications. We can also give you an injection of steroids in the area to calm down the inflammation. Recommend putting ice every day. And if those conservative treatments don't work, then we go to surgical treatments, which usually include having surgery in the area. There are different types of surgeries that can be done, but they all involve cutting the bone. Usually it's a fairly quick recovery. The patient will walk immediately after surgery and will be in a surgical shoe or a surgical boot for 2 to 4 weeks, but it is a easy recovery. The bunion is not that there is a growth happening in that area, it's that the bone is not straight and the bone keeps tilting and moving, and that's why you see that it appears to be growing. Usually we'll be changing shoes. Another good recommendation is a good pair of orthotics, which is an arch support made out of a mold for your foot. What that does is prevents it from becoming worse. It does not correct the deformity, but usually that is what is recommended. Hammertoes and bunions are extremely common, and usually someone that has bunions end up having hammertoes. A hammertoe is actually a digital contracture. The toe starts going up, and what happens is that the tendons start getting smaller and smaller. The way to correct it usually is the same as bunions. You can do padding, orthotics, wider shoes, but it becomes a point that does not alleviate the pain, and then surgery is indicated. Like bunion surgery, it is a relatively simple surgery. You just go in and cut the piece of bone out, and recovery is quick. It is something that we do at the same time. If you have a bunion and a hammertoe, we can correct at the same time. So then the recovery is just one instead of having 2 different types of surgery. You do not have to go to a hospital to have these procedures done. We have an outpatient surgery center, and it all can be done on an outpatient basis. If you happen to have problems in both of your feet, we usually recommend to have one foot done at a time so you can have the other foot to put more weight in order for the surgical foot to recover easily and without much pain. After having a foot surgery, usually patient is able to go into regular shoe gear within a month of surgery. It is not recommended to wear high heels higher than 2.5 inches, and high heels should not be worn for a whole day. I will say the top 5 conditions why patients come to our office. I will say number 1 is onychomycosis and tinea pedis, which is fungal toenails and fungus in the skin. Plantar fasciitis, which is heel pain. Achilles tendonitis, which is a pain in the Achilles tendon. Bunions and hammertoes.
Well, I've been a diabetic since 1989. However, we do have certain circumstances in our bodies that we're not aware of. That's why we have to search and make sure that we have the proper doctor to deal with the conditions that surface in our bodies. Dr. Marieli was a very personal, loving care person. So she took me in under her wings and treated me with love, with care, and she's been very professional with me. I visit Dr. Marieli every 90 days, and she has the opportunity, if anything goes wrong within those days, to feel free to come back to her office to see her and let her correct the problem.
I thought my feet had corns, but they actually were hammertoes. They look like a hammer. Diabetic people have a lot of trouble and they got to really watch their feet, because if you get an infection, you can lose a foot or a toe or whatever. That's why I come every 3 months to get my toenails clipped, and he checks my feet. I really recommend the staff. They're great. They're really great. I mean, you come here and it's like you're coming to see a friend, but you come to see a doctor.
Bunions, bone spurs in my right foot. So went to see him. He diagnosed me, did the surgery, went really, really well. I'm happy with the surgery because, been in the military for 26 years and being in boots all the time and not the proper boots actually contributed to a lot of my foot problems. So that really helped out.